Oh,
It's recording. I see it.
oh, thank you, Kate. See, I knew I needed Kate in here. But I do realize, going back to it, I do realize that so many nurses are not passionate about policy, and some really will never be passionate about it, and that's okay. My hope is that even if the passion isn't there, that you'll be educated to a point that you feel empowered to be involved. Education definitely promotes involvement, and involvement promotes change. And as rural nurse leaders, we can and should be leading change. I'm limited to 2 hours for presentation, so we'll have 1 hour here and then 1 hour in July. So obviously I can't give you what you need to go change the world in healthcare policy. That's a very broad and complicated subject matter, and I certainly can't cover all of that. But in light of those two thoughts, I've chosen to include some very basic but effective evidence-based information that I want to share with you over the next 2 sessions. I will provide some tangible deliverables that I hope you can find helpful. And again, I realize that for some of you, this may be a boring review. For others, it may be the very first time you've ever heard this information. But again, for all of you, my hope is that it empowers you to act. So let's get started. So the project consists of a pre-survey on healthcare policy advocacy, which obviously you've already completed. 2 educational sessions, this being the first, and a post-survey identical to the one that you completed initially. So we're going to measure pre and post. During the first session, we'll cover rural hospital closures and how that fits into the project. I will show you the results of the survey that you completed. I think that if you took the time to complete the survey, that you might be interested in seeing how those results turned out. And then I will use solid evidence-based research to jump right into healthcare policy advocacy communication. That's a mouthful. During the second session, we'll look at reliable resources to further your policy advocacy education. We will look at a couple of very specific rural policies, and then I will show you how policy becomes law. I debated on whether to put that first or second, but in this first one, we're sticking with some very basic stuff, and then I'll move into more on the second session. Just know that the presentation will be interactive at several points. Please be ready to participate. The rules are completely anonymous, and the data will not be used in my project. It's just a fun way to keep everybody interactive and break things up, the monotony of just hearing me talk. So as I introduced on the first slide, the DNP project is on rural healthcare policy advocacy as it relates to the rural hospital closure crisis. I want to review some of the startling evidence on the closure crisis. The North Carolina SHEP Center, which is one that I watch constantly, it tracks every single rural hospital closure in real time. And many of you probably are familiar with that educational resource. I do use it often, but 128 rural hospitals have closed since 2010, with Texas leading the nation closures at 24. That's really not an area that leading means winning. So we really need to address that. NRHA has released data showing that roughly 1/3 of all rural hospitals, or 673 more, are at risk of closure right now. So in looking at evidence, there's a few other things that are happening to avoid closure. Rosa Mantle, I don't know if any of you know her, she's very well known for her rural OB research and studies. She noted that 179 rural hospitals have terminated OB services in the 10 years between 2004 and 2014, dropping the percentage of rural hospitals offering OB from 55% to 46%. And note that that study ended in 2014, and I personally know of many more OB services that have closed in the rural areas. And I feel like some of you probably are in hospitals that have been affected by the discontinuation of OB services. I think there's some on the webinar here today. So it's definitely something people are trying to do. They're looking at ones that are not money generators and just trying to stay viable, do what they need to stay viable. So why is all of this happening? Well, that is a great question, and the literature tells us that a big part of the reason that this is happening is because healthcare policies are passed without consideration of rural impact. And you might ask, well, how does that happen? Well, that's another great question, and somewhat is the question that led me down the road to advocacy efforts. But another article that I read and several other research materials that I looked at tells us that the reason that's happening is because we as rural healthcare leaders are not knowledgeable and or involved. That really hit me hard, to think that uninvolved, I'm part of the very problem that I'm passionate about addressing. So it's part of we are part of the problem if we're not involved and vocal. I'm going to stop just for 1 second because there's one more person needing in. Okay, I just had someone else pop in. So let's move into a little bit of a different gear and get started with the survey results, because I think they were kind of interesting. We'll move through these slides fairly quickly on the results. So stop me at any time. I don't have you muted on my end, so if you guys want to mute and unmute on your end, that would be perfect. So I opened the survey on June the 2nd. I closed it on June the 10th. I sent it out to 55 rural nurse leaders. One more person, I'm admitting. I sent it out to 55 rural nurse leaders from the Texas Panhandle. 23 responded. 2 did not complete their survey, so I had to discard those 2. So we have a total of 21 out of 55, or 41%. And actually, that's pretty good for a survey. The ages range from 31 to 70, with years of experience ranging from 9 to 48. And you can see here on this slide that our educational levels went all the way from an ADN to a DNP, and then there were 4 others. And I know at least 3 of those others are BSNs with either an MBA or an MHA. I wasn't real sure on the 4th one, but my guess is it might be the same, maybe all 4 of those. So it was it's a varied group that participated. This slide is just simply showing you the exact same data I just went over on the educational levels, so I won't spend time on that. This one is where we really start with the questions. So 62% of you answered that you agree or strongly agree that you have engaged in rural healthcare policy advocacy in the last 3 months. So you're pretty active, 62%. You can see here on this side that when we move from local to state, the agree and strongly agree answers of involvement in rural healthcare policy advocacy over the past 3 months drops to 43%. So 9 out of 21 of you are active at a state level. And then sadly, at the federal level, that number plummets to 15%. So only 3 out of this whole group agreed or strongly agreed that you're active in federal advocacy efforts. This was the lowest scored question on the survey, so very few are active at a federal level. Now, when we change to future intent to engage in policy advocacy at a local level, 16 out of 21, or 76 of you agree. Again, a pretty high percentage when you're talking about local levels. Again, same thing, future intent at a state level drops some, so 9 out of 21 agree that you're active at state level. And then again, future on a federal level, 5 out of 21 said that you would plan to be active, so 24%. So you can see that that's from local to state to federal, even whether it's past or future, those numbers really decrease. Federal, unfortunately, being the lowest percentage of participation, is actually where the action happens for most healthcare laws or bills to get passed. So that's the thing that I would like to address. So switching gears a little bit on the survey results again, 17 out of 21 of you, or 81%, agree or strongly agree that RNs are ethically obligated to be active in policy advocacy. And I was really glad to see that was that high, because you're spot on your thoughts on policy advocacy being our ethical obligation. So in every literature review that I did, I found that it mentions that we need to be involved. It's our obligation. And if you look at any specialty organizations such as AACN, ENA, ONC, A1, any of them, I could go on and on. They all have statements that identify policy advocacy as an ethical obligation for an RN. The Institute of Medicine and the Robert Wood Johnson Foundation state that policy advocacy, they list it as essential for all RNs. And the National Council of State Board of Nursing requires that all nursing school programs at a BSN or higher include policy advocacy education on some level. As you go into the higher degrees, obviously you have policy education, but even at a BSN level, you are required to have some introduction to policy. And to take that just a little bit further, the DNP Essential 5, which is on advocacy and healthcare policy. They actually have one whole essential policy. It highlights the utmost importance on policy advocacy from nursing. AONL or AONE, whichever one you remember that by, lists advocacy as one of their required competencies for their nursing leaders. And I'm sure most all of you have heard of the 2010 Future of Nursing report. It called for nurses to become full partners in designing the U.S. healthcare system. We can't be full partners if we're not versed in policy advocacy. We can't change the system if we're not active and vocal in the system. And then Sigma Theta Tau lists policy and advocacy as their top two initiatives in their mission. So I think I could go on and on, but I think it's clear that the evidence does show that yes, we do have an obligation to be active in healthcare policy. So I hope that that's been something that you'll put some thought into. So moving on with the survey, only about half of you, 10 out of 21, felt that policy advocacy is required by our practice guidelines. And again, I think you could take that either way. While the MPA nor the board rules implicitly state that advocacy is a requirement of our practice guidelines, the American Nurses Association Code of Ethics notes that policy development and advocacy is an indivisible part of nursing practice. And they go on to say in their social policy statement, they incorporate participation in policy development and advocacy engagement as the responsibility of every single nurse. So I guess you could take that either way. And the question actually came out about a 50-50%. So I would say that you were spot on that as well. This one was the second highest rated question on the survey. So 18 out of 21 of you feel that you have the skills to interact at your own hospital and at local city or county level when it comes to policy advocacy. And that's great. So most of you feel fairly comfortable in your hospital or even in your town or county. But what did stick out to me on this slide was that means 14% of you either were not sure or you don't feel you have the skills to interact in policy in your own setting. That worries me a little bit. Either you didn't have good succession into your current position, maybe you weren't given the opportunity to learn or feel confident in policy advocacy. Maybe your administration is not supportive. However, that was not what I saw on that question, and we'll get to that in a minute. Or maybe you feel like you have no voice in the matter. But either way, I would hope that we could work to change that, because to be an effective leader and patient and nurse advocate, you should and need to feel comfortable in policy advocacy in your own environment. You have to be able to feel like you can speak up. It's just imperative almost for us to lead in this time with the chasing zero and all of that we're able to speak up. So the next question, when looking at the results of the question about skill level at a state level, that number dropped as we saw earlier, and even further at the federal level, as I pointed out. This slide shows that 12 out of 21, or a little over half of you, felt you had the skills to interact at a policy at a state level. So 43% of you noted that you had been involved when I asked about state. However, more of you feel that you're skilled in that. 57% of you feel like you're skilled in that. So it made me curious to think, what would it take for those of you who have the knowledge and the skill to become involved. So not that I can answer that question, but a big reason why many people are not involved, in nurses especially, is because we don't have the education. But if you have the education and skills, what would it take for you to become involved? Think about that. Not that you have to answer it. And again, at the federal level, only 7 out of 21, or 33%, agree or strongly agree that you have the skills. So fewer feel comfortable working in a federal environment, obviously, and it is very intimidating, or it can be, but my hope is that we can change that to some degree. So remember that the current level of the advocacy in this group at the federal level was only 15%. That was the lowest rated question. And then the future intent to advocate was only 24. So several of you feel as if you have the skills in this area too, but you're not involved or plan to be involved. Again, that's interesting to me. That could be for any number of reasons. Maybe time constraints, just have no interest. As I said in the beginning, not everybody has a policy interest. Or maybe you're not aware of the issues, and maybe we can talk about that, and we will later. But again, what would it take for you to be involved, to be active in policy advocacy? 71% of you, 15 out of 21, stated that policy advocacy was an expectation of your job, and I'm glad to hear that. And I was thrilled to hear that 76% of you felt that you had supervisor support when participating in policy advocacy. That is absolutely awesome. And the evidence does not show that to be the norm. As a matter of fact, often nurse leaders are not involved in policy advocacy efforts because there's not support from their superiors. So go rural, we're rocking that one, because I'm so thrilled that you have the support of your superiors. That's so important for you to move to the next step. This was the highest rated question in the survey. 90%, or 19 out of 21 of you, agree or strongly agree that advocacy does improve healthcare policies at the state level. Think how much more effective we could be if more of us were involved. And this was the last question on the survey, and then we'll switch gears again. So 16 out of 21 of you, or 80% of you, feel that policy advocacy has a positive impact at a federal level. Advocacy is important and effective. Nurse leaders must have a seat at the table. Going back to survey results, so 80 to 90% of you feel policy advocacy is effective at improving policy. Involvement over the past 3 years, again, only 43 said you were active at a state level, and sadly, 15 were active at the federal level. What I want to tell you is that's totally in line with what I found with the literature review. Nationwide, only 21% of our involved in policy advocacy, and only 32% they could have impact in policy decision making at a state or federal level. So again, that begs the question, why? Why are we not involved, and why do we feel we have no impact? Again, turning to the evidence, the why is answered in one simple word: education, or lack of. The evidence really pointed that out as the number one factor that most nurses are not involved in policy advocacy. Janison et al. Study that health policy advocacy is highly effective at increasing knowledge and participation. Another study that I read, completed a study that specifically targeted frontline healthcare leaders and found that policy advocacy education was most effective in every group. So just as a sidetrack to tell you, when I first started developing my project, I included all rural stakeholders, with community members being the most substantial, and I thought that's who I would target. But the literature supported a change away from that population and suggested that I focus to rural nurse leaders, because you are the group that stands to make the most difference. Is something okay?
Melissa, she seems to have feedback going on.
Okay. Kate's telling me that we have a lot of feedback. Let me see if I can mute. Oh, participants. Mute. Okay, let's see if that helps.
Sorry, carry on.
No, perfect, perfect. So anyway, that's why I chose to move away from the complete community members and target my DNP project just to nurse leaders. We stand to make the biggest difference. And I think I'll show you that in just a little bit in the, well, actually this slide right here. So this is why nurse leaders have such incredible potential to be so strong in healthcare policy as healthcare policy advocates. Nurses have been voted the most honest, trusted, and ethical profession for 17 years running in the Gallup polls. I'm sure that is no shock to any of you. You've heard that year after year after year. We are almost 4 million RN strong in the United States, 335,000 in Texas alone, with another 100,000 APRNs in Texas. Nurses occupy the largest healthcare employment segment, and we have the skill set. We already do for our patients and our staff what we need to do on a bigger scale. We assess, we analyze, we adapt to fluid situations, we deal constantly with conflict management, we communicate effectively in the toughest of situations, we have clinical expertise and empathy most of the time. Every now and then that empathy fades, but for most of us, most of the time, we're very empathetic. Those of us who work ER for too long, sometimes we get a little jaded, but we are for the most part empathetic. All of that, every single one of those transfers effectively to policy development and advocacy. So we have all that going for us, but while we have incredible potential as policy advocates, we don't perform up to our potential. We are ranked the least influential stakeholder in health policy. That saddens me. We're described as almost unnoticeable in the policy arena. Only 5% of seats on hospital boards are held by nurses. A U.S. Senate seat has never been held by a nurse. We have never had a nurse governor or a U.S. president or presidential candidate. So we do have some representation, though. We have gained representation slowly. So I'm going to actually open a poll and just see who can tell me if you know who these women are. Do you know who these women are? And I'll give you about 20 seconds or so to click into that poll. Okay, I'm going to go ahead and end it, and I'm going to show you the results of that. So not one person in our group knew who these women were, and I didn't leave the picture up very long before I opened the poll. But what I would like to point out to you is that these women are the only 5 nurses that we have in the 116th Congress. So Karen Bass, who is this one right over here in the red, she's actually from California. She is an LVN, but the first PA to ever have a congressional seat. Diane Black is from Tennessee. She's an RN. Eddie Bernice Johnston, she's actually from Texas. She's been, she's had her congressional seat for, I think, about 30 years. She's been on the, she's had her seat the longest. She was the very first RN ever elected to Congress, and she still actually holds an active Congress seat. All of these do right now. So she has been very influential with decisions made for healthcare. Lauren Underwood, who is down here in the blue, she's actually quite a go-getter. I've followed her for a little bit. She's the first millennial to be elected to Congress. She has a dual master's degree in public health and in nursing administration. And of interest, she got her start into policy by being awarded the Government Affairs Fellowship through AACN. And we'll talk a little bit more about fellowships in the second session, but that actually is what piqued her interest and got her started down this path. And then Donna Shalele is from Florida, and she's had a seat for quite a while. So we do have some representation, just not enough. So to recap, before we move on to the next session, we have covered the rural hospital closure crisis, how it relates to healthcare policy, I've reviewed the results of the survey that you guys participated in. We've talked some about nurse leaders' ethical duty to be active in policy advocacy. And we've looked at reasons why nurse leaders have such great potential to be advocates, as well as why we're not. Now let's get into what this project is really about. How do we address the gap? Well, as confusing as it may be, and that's why I put that crazy education turning backwards, there is a confusing myth that tells you that you have to have extreme education and be very politically versed to be effective in policy advocacy. That simply is not true. You do have to have education on the subject matter, but basic education and a desire to change is what it takes. Education empowers you to boldly speak up about what you believe is right for your patient. And really, that's it. You don't have to speak the political jargon. You just have to know the basics and you have to walk it forward. So I'm going to take another poll here just for a minute. Let's talk about this advocacy thing because that's what my whole project is about. I want to give you just a moment and I want you to tell me what 3 words come to mind when you hear the word advocacy. Let me get to the right poll here. All right, you should see that poll on your screen, and I'll give you a few seconds to complete that. What 3 words come to mind? Okay, I'm going to go ahead and end the poll, and I'm going to share the results. So really, a lot of you, responsibility was the biggest one. So you can see those, leader, policy, and really none of those answers are wrong. Every single one of them would be something that I would consider policy advocacy. I was just curious to see where you guys fell on the spectrum of that. And so this next slide is a word cloud that I put together that comes to, these are all the words that come to mind when I think of advocacy. And as I did my research, I found these words repeated over and over and over. So with leader being the #1 word, leaders are our advocates. So you all are leaders. You're rural nurse leaders, and that's even a little bit different than a regular leader because you wear so many hats. I know we switch our hats all day long. So just take a moment to review the words on this slide and think about how you see yourself fitting into each one of those words on there. Trust, power, manager, competence, inspiring, responsibility, coaching. I could go on and on. Motivation, those words all fit to be a leader and an advocate. So advocacy is obviously what my project is about. And you guys advocate for your patients every single day. You advocate for your staff, you advocate for your preferred budget, you advocate for evidence-based policy change. You are an advocate by nature if you're a nurse leader. Do you advocate for health policy though? Depending on how you answered that question, why or why not? And you don't have to answer that out loud. I'm just asking you to think about a few things. As I mentioned previously, most nurses by nature are not drawn to policy or politics. We got into nursing to take care of patients, and that's what most of us really just want to do. We don't want all the drama. We don't want all the policy. We just want to take care of our patient. Just let us take care of our patient. And I'm probably the most apolitical person you will ever meet, but I am, and I have always been a staunch bedside advocate for my patients. And I try to do the same for my staff now that I'm in a leadership role. I see healthcare policy advocacy as that same thing, only on a bigger scale. Instead of advocating for one patient at the bedside, being active in healthcare policy allows me to advocate for a whole population of patients. And who better to advocate for the patient, for policies that affect the patient, than the nurse? We're the boots on the ground, and we know what works for our patients. You don't want somebody who doesn't know healthcare from the inside out making policy for our patients. That's why we have to have a voice at the table. So as with anything that we want to learn, we start by asking who, when, where, what, why, how, any of those questions. We're going to start with the who, and then we'll probably go out of order a little bit, but we're going to cover most all of these questions. So I have one more poll for you. Who can tell me who your representatives are? And I'm not asking you to name them. I'm just asking you a yes/no question of, if I asked you to name them, could you? Could you tell me who your congressman is? Could you tell me who your senator is? Okay, I'm going to show you the results of that. So that's awesome. About 50% of you, or 44% of you, actually know your representative, and that's not unusual either. Very few people know or can name their congressmen and senators. So I found that in my research as well, that seems to be the problem, or one of the problems. So we're going to start the educational part of this program by showing you exactly how you find out, so simple, how you find out who your representatives are. If I were smart enough and if I were a tech guru, I could click on this link, but I tried it a million times and got nothing but frustrated. So instead of clicking on that link, I actually just took screenshots because it made things a lot easier for me to move through the presentation. So, and I've provided that link for you in your reference sheet that I sent out this morning. So if you were to go to that reference or click on that link, you would go to a screen that looks just like this. And you can either start by filling in your address and your zip code, or, oh, close my poll results. Okay.
Sorry.
Nope. Stop sharing results. Missed that one. Sorry, guys. Okay. So you would get to this screen right here. And it's so simple. You don't even have to put your name in. You put your address and your zip code, or better yet, you can just put your county. And that's what most people probably do, because it's a simple click. You click on here, it's a drop down. You put your county in, and you would come to this screen right here. On the left side, I would go here and click Childress, and then I would click Find. And then I would get this screen on the left side. It shows Childress County, as you can see in the red box. And I would be able to click on any of my representatives there. Actually, this one right here, I'm not sure how clear that is on your screen, but it does still show Representative Thornberry for the 13th Congressional District. And it's probably many of you, maybe most of you, all of you, I don't know. No, he actually is retiring. And so there is a race right now for his seat. And all I can say about that is please educate yourselves and vote. I'm not going to get into, I'm trying to keep this bipartisan, so I'm not even going to go there. The two people running for his seat are Weingarner and Jackson. And I'm just going to say again, I'm chasing rabbits a little bit because this isn't necessarily part of the presentation, but please go vote. It's most important. And I don't know, I'm not sure exactly where everybody is on, because I didn't think about all that as you were signing on, but I would dare to guess that most of you probably are going to be affected by this outcome right here, because most of you, I think, are in the 13th district. It's the Upper Texas Panhandle. It goes across just north of Lubbock over to Wichita Falls. So if you're in Lubbock, I think you're in the 23rd or 4th, I think, congressional district. Anyway, I'm sidetracking, but please vote. For anything, vote, so that, you know, we have a say in who represents us and how things move forward. So if you were to click on one of these, and I just clicked randomly, again, I'm not trying to be partisan here. I just clicked on one. It takes you straight into their website, and it would look like this. And their websites are all very interactive. So you can find out what bills they're supporting or opposing, what's happening in their professional and personal lives. And you may not think that you need to know what's happening in their personal lives. However, when you start interacting with them, to be able to make a personal connection makes all the difference in the world. It may be that one sentence from you in an interaction is what makes them remember you, or know that you did your homework and they have confidence in you from that point forward. So it is important, and I'll talk more about that later in the presentation as well. So some other general tools to make your communication with policy officials more effective, and to give you some upward momentum. Know when and where to capitalize your ask by knowing your policy leader's stance, by tuning your pitch to whatever policymaker you're talking to. I'm not saying waver on what you feel is important. I'm saying know who your audience is. It's important. Familiarize yourself with who you're talking to. Do a little research. It's really quite easy to find out everything about anybody nowadays. Not everything on this list will be applicable to every advocacy effort, but keep in mind what might apply. For example, if your issue has to do with rural healthcare closures and the person you're addressing was a champion for that issue or even a like issue, or if he or she were a physician or better yet, a nurse in his or her professional career before Congress, play to that. You have to know that information though in order to speak to it. So it is important that you tune your pitch and you know your audience so that you get the best results. It's quick and easy to find out, again, almost anything about anybody. So why would you not go and do your research? There's this thing called Google out there. Have you ever heard of it? I'm sure you have. Use it to your advantage. And again, know who your audience is. The next one, what are the issues? Why are they issues? And how are you alerted to the issues? This one is a little trickier, and unfortunately, there is not a one-stop shop to answer this question. You have to put some effort into this one to be able to answer the what, why, and how. You have to be involved. The best way I can tell you to be aware of the issues is to be involved, to be active in your professional nursing groups. That's probably the number one way. TNA, ANA, AACN, ENA, ONS, A1. I could go on and keep listing them. Grassroots advocacy groups are great to know the political issues. If your hospitals are members of TORCH or NRHA, you have full access to all of their resources. You can get into their PACs or political advocacy committees, and you get updates every day if you want them. Sometimes they get a little overwhelming, but there's plenty of ways to get the information, but you have to do a little searching and you have to put forth a little effort. We have a small rural hospital CNO group that helps me as much as any bigger group to stay on top of those issues. And I love that group. As a matter of fact, I've missed meeting with them since COVID has somewhat distanced us. But if you want to be involved in that group and you're not already, contact me and I can get you on the notification list for that. We don't only talk about political or policy issues, but care issues, new regulations coming down. I think all of that has to do with leadership and with advocacy, all of those rolled up in one. So what is the best form of advocacy communication? Who can tell me what event in 1990 changed the landscape of advocacy and really almost everything else about the world as we know it? So here's your next poll. Let me get that going. There you go. What do you think changed the world? I'll give you just another second or two. And I'm going to share the results. EMTALA did change the world, believe me. And every time I feel like we're going to get an EMTALA violation or a complaint, it changes my world because I've been through an EMTALA survey before or an investigation. I'm not sure I ever want to be back there. But actually, the answer is internet. It did change the world. It changes how we communicate. It changes how we relate to people. It changes everything. So yes, it was the internet. Did that poll go off? Okay. I want to make sure. So yes, absolutely. It was the internet that changed our world. The invent of the internet and email, communication to the House and Senate soared after this invention. As you can see, I put some statistics up here. Communication increased 158% to the House and 548% to the Senate after basically email. And currently, communication to both are at an all-time high. Some of that has to do with the controversial Trump reelection. I'm not getting into that. Again, I told you I'm going to keep it bipartisan. But the other big thing that probably plays into that hitting an all-time high is this COVID-19 crisis and the riots. The COVID-19 shut everything down. We can't visit. We can't go to the White House. It's locked down. Even now, even though most of the world's opening up, they are not allowing visits to the White House or to the Hill. So email is how we communicate. So again, with that said, it is the most common way that citizens engage with lawmakers. It's easy, it's fast, it's effective, and you really don't have a lot of other options right now. I guess you could send snail mail. It just seems that's a thing of the past, though. So why is email the best form of communication? Here's the evidence I found on that. When representatives of the House and Senate were asked how much influence postal letters and emails had on their decisions, here are the results. 50% of them said that generic postal letters had some influence on their decisions. But you notice here in this dark blue second column, that jumped to 88% if the letters were personalized. 56% said email messages had some influence. However, that topped out at 92%. So this one, the second blue line, when those emails were personalized. When the question was asked the same way, but instead of some influence, the words a lot of influence was placed, the response dropped some or significantly. So only 3% of our leaders said that an email or a postal letter had a lot of influence when they were making decisions. But what's striking to me is that if you personalize those emails and letters, even just a little bit, those numbers change from 3% to 27% for postal letters and 30% for emails. So you can see that personalizing the communication does have impact. You have to personalize your communication. We often see form letters, or we get form letters from our state agencies asking us to fill them out and send them in. That's great, but take a moment to add a little bit of personalization before you drop that in the mail or email. So you're asking maybe, how do you personalize that? And I want to give you a little bit of information on what the evidence showed was most effective at personalization. So again, when the policy leaders were asked, what is helpful in personalization of a letter or email? So they were asked that's the dark blue lines you see across here. And then this survey actually compared it to how often the constituents include this data in the communication, which you'll see are the light blue lines above each one. So starting at the very bottom, 91% of policy leaders find it helpful if their constituents include information on how a bill would impact a district. Sadly, only 9% of the time that information is included in the communication. 79% of our policy leaders, find it helpful to hear a personal story related to the bill or issue, but we rarely include that. 18% of the time they get that. We're a little bit better when it comes to explaining our reasoning for our specific ask. You can see here that 90% of congressmen and senators stated that they find it helpful in decision-making when their constituents list the reason for supporting or opposing a bill. But even then, only 50% of the time we include that information in our communication. And again, about the same, 88% of the time they find it beneficial if we tell them our specific ask. And this one surprised me because only about 60% of the time we include that. That really confuses me. If you're writing to a congressman or a senator, there's a reason you're writing. You have an ask. Rarely do we drop a line to our senators or congressmen just to say, hey, how are you? I thought I'd check in on you. We usually have an ask, but it's crazy to me that we wouldn't put that in our communication. So again, this information validates the need for us to tell our personal story and how it impacts our district. It will have more of an impact for them receiving the letter. So what sorts of personal communication make it successful? The evidence says that your chances of success increase significantly If you include these things, again, what I just talked about, tell them exactly what you want from them. Don't be shy about it. Provide the local impact. What's happening in that district that makes you feel so strongly about that policy? And then always relate it to a personal story. And I'm going to go into quite a bit more detail on a story because there is a lot of evidence on storytelling and how it changes things. So to drill down just a bit more, and I'm spending quite a bit of time on this personalization thing because it can make the difference, all the difference in the world. So to drill down just a little bit more, start by introducing yourself and telling them a little bit about your position. So that might look something like, as a rural nurse leader in your state or in your congressional district and a member of AONL or whatever other organization you choose, or if you've looked them up and know a personal connection, include that, like I mentioned earlier. Tell them specifically what your ask is. So again, it might look something like just as simple as saying, I'm asking you to please support Save the Rural Hospital Bill. And then follow it with local impact and a specific story. Use factual data when you can. It gives you credibility. Have the evidence to back up your ask, support your ask. So that might look something like, as you know, 97% of the country's landmass is rural, with approximately 60 million or 1 in 5 Americans living in rural areas. Access to healthcare is vital to these rural Americans, and that access is threatened as the rural hospital closure crisis escalates. Texas is leading the nation with rural hospital closures. Again, that tells it how that impacts you, or you might want to take it one step further if you know of a hospital that's closed and an incident. And I'm going to go into that in my next slide, I think. I think it's this next slide. Yeah, it is. So I truly cannot overstate the importance of a story. Again, bring your statistical data to show your due diligence in evidence gathering, but statistics are not what people remember. Stories are. Stories that touch emotions are what's remembered. Get them on your team with your story. Let's review some evidence-based effective elements of storytelling. Begin with an end in mind. So know what the goal of your story is. Don't just ramble on with some story. Set the stage and provide context. Don't start in the beginning if the beginning's not relevant to your point. You're not going to have a lot of time with these people, whether you're in person or whether it's an email. You need to set the stage. You need to paint the picture, bring that story to life, be passionate about it, and use emotion. This is where you would tell the story that affected you personally. Tell why you're passionate about it. Describe the struggle. Tell what the downside to the issue is if the bill is or is not passed, and include a surprise element if you can. This one is always sometimes a little bit tricky and you don't always have that ability, but show how there can be a positive outcome if you can. What does it take to have a positive outcome? Don't be all doom and gloom. As with everything, do not present a problem without also presenting a solution. That kind of goes with anything. Even when you go talk to your supervisors, try to have some solutions in mind. And always, always be authentic. I can't stress that enough either. They have enough of the political game, and they really don't want more lobbyists or game playing. So when talking about the rural hospital closure, I'm going to relate it back to that because, again, that's what my DNP project focuses on. I tell the same story. It had a huge impact on me and is one of the driving forces for me for the reason that I passionately support rural hospital survival. And as I mentioned earlier, stories are so much more impactful than statistics. A picture puts a face with a name. A picture's worth 1,000 words. We've heard that over and over. So let me just take one moment to put a face to this story. It is with permission from his widow that I've included this picture in this story, and I include it frequently in my fight for rural healthcare survival. It's real. I'm absolutely authentic and passionate when I tell this story. This is a 60-year-old gentleman and his granddaughter, the picture is. This gentleman called for 911 assistance in Guthrie, Texas. Most all of you probably on the call know Guthrie. I'm not sure everybody because it's a tiny little town, but he called for assistance in Guthrie, Texas after having crushing chest pain. Guthrie has no healthcare access and has only volunteer EMS responders. By the time the volunteer team responded, this gentleman was almost an hour into his cardiac event. Transport to my facility in Childress, Texas was another hour away, and yet we were the closest facility. A 2-hour window for a heart attack victim can make or break. It can be the difference between life or death. And that was the case for this man. He coded upon arrival to our facility, and we were unsuccessful at reviving him. I can't help but wonder if he could or would have had timely access to care, if he could have had lytics, anything, would he still be alive today? His wife works in our facility, and there's not a time that I see her that I'm not haunted with this story. Lack of access to care is real, and it's deadly in our rural and frontier communities. We must and can change that by supporting the survival of access to care for the rural people. That's a real story, and that's a real picture of him. And you better believe I'm passionate when I talk to congressmen or senators or whoever will listen, because it affects our lives out here in the frontier areas. So going back to what I told you was evidence-based for stories, let's think about the story I just told you and how that relates. So begin with an end in mind. The end message to my story was to stress the importance of access to care for the rural people. That was the whole point of my story. Set the stage or provide context. I set the stage by informing the listener that this patient was in an area with no access to care when the event happened. I tried to paint the picture by giving details of life and death in a situation that perhaps death didn't have to be the end result. I described the struggle. The struggle was being 2 hours away from access to care in a community with only on-call EMS, having no hope of initiation of care in that golden hour. And in my case, the surprise element is that his wife works at my hospital and I see her every day. So that adds impact to the story, because it not only provides local impact, it provides personal impact. I feel it. It was a lived experience. The upside is that we can make a difference in the future by fighting to save rural hospitals and rural healthcare access. And of course, be authentic. And as I told you, that story is a lived experience, so it's a very authentic. Don't just make some story up, but you've got plenty of stories. I know every single rural facility has plenty of stories, and I know we can do better. We just have to. A person's zip code should not determine their lifespan, but unfortunately, this social determinant of health often determines the outcomes for our rural people. So that wraps up storytelling. So there's a few more things that I want to touch on. You have to create a collaborative spirit of team building with the policymakers for them to hear your issues. They have to hear it. They have to feel it. They have to recognize it, and they have to remember it. So you have to connect the dots from what you care about to what they care about in a way that they align. It's about motivating them to see your side of the story and react positively to it. And I'm getting close to the end, so hang with me, but be concise. Realize that your time with a congressman or senator, or even their healthcare staffer, the times I've been up on the Hill and walking the halls of Congress and the Senate, I rarely actually get to have face-to-face time with a congressman or senator. Usually we schedule with their healthcare staffer, and even that's very limited. So know what you're up against, but also know that their attention span is very short. So just for fun, I'm going to throw in one more poll here, and I want you to tell me what you think the human attention span is, just for fun. This one's completely fun. All right, so I'm going to wrap that poll up and show you the results. So only one of you thought it was 2.8. The majority of you thought it was 12 seconds. I'm going to stop sharing that, and I will actually get back into the presentation, and you're going to be quite surprised. So in the 1980s, again, 1980s, 1990s, our attention span was 22 seconds. The internet and technology changed all of that. And in 2016, our attention span dropped to 9 seconds. And currently it's 2.8 seconds. That is hard for me to believe. It just seems absolutely crazy to think that we have become such an instant society with technology at our fingertips that our attention span has dropped to 2.8 seconds. Remember that your congressmen and senators and their healthcare staffers are in the same boat we are, so their attention span is 2.8 seconds. When you combine that with the fact that each congressional member receives anywhere from 150 to 350 emails per day, just like us, they're often looking at those on our phone. We have our phones in our face all the time. We're looking at stuff on our tablets. So think about how a long, unformatted email looks on your phone or even on your tablet as opposed to a concise and formatted email. Think about having the data elements in an attachment or perhaps a bullet point style communication so that it's a one glance and get the message kind of thing. Think about what makes the data interpretation easier and faster when someone is scanning the communication as opposed to actually reading it. Our communication has to be concise and to the point to be read and effective. Otherwise, they'll never give it a second glance. So AONL did some research, and that's where I got quite a bit of these with the poll question, but they ask our congressmen and senators, what is the most effective length for email or even a snail mail, a postal letter? And the answers are on the slide, but you can see that you need to target your communication to be somewhere between 100 and 300 words. And that's about 1 page of double space writing. That's it. So that's very few words to get all of the above mentioned items covered. You have to make every word count. It has to be, you know, just pretty brief and to the point, even in your storytelling. But you can get a lot of message across in a short time if you do it right. And a few other last but not least tips. So subject lines on emails can make or break your communication. It might be the difference of whether your email is opened or not. So have a good subject line. And believe it or not, the research showed that sending emails on nights or weekends to your policy leaders increases your chances of it being read and effective. They get so much email during the day and they have so many other commitments that the weekends seem to be a little bit slower for them, and they can look through their emails a little more carefully. Stay out of the weeds. And I say that, by that I mean be authentic. Do not come across as a lobbyist. I touched on that earlier. You are a constituent with a real need, or you wouldn't be addressing them. You have a real ask, a real interest, and stick to that. Just be real. Use form letters if you have to, but personalize them. Better yet, write your own letters. And I'm going to leave you with a letter template. Probably in the second session, we're going to go over letter templates. So if you ever have the opportunity to meet with your congressman, and I'm not saying up on the Hill, walking through Congress or the Senate, although that too, but if you meet with them at a town hall or you go to a reception for them, get a card, ask who their healthcare staffers are. Always, always get a business card and always email them a thank you or acknowledgement. They get a lot of stank email. You better believe that they do. So make yours a thank you email. And also build a relationship with them. Email them often. Make them know your name. When you develop a trusted relationship with them, often they call you to ask your stance on healthcare issues. And that's a good thing. We want them to ask those of us who have boots on the ground, we want them to ask us, what do you think about this policy? That's important. So in wrapping up, I just want to go over this again. We've covered the rural hospital closure crisis and how it relates to healthcare policy. I obviously showed you the survey results, and we talked about some of the nurse leaders' ethical duty to be active in advocacy efforts. We've looked at reasons why nurse leaders have such great potential and why we don't use that potential. And then lastly, we reviewed advocacy from the rural nurse leaders' perspective. the evidence to support the most effective form of communication, and how to make the most of that communication. Remember, personalize your emails or your communication, tune the pitch to who your audience is, and be concise. Wrap it up in just a few short bullet points if you can. So this is our last poll. This is the slide you've all been waiting for. So I'm going to open this poll up, but just quickly, this one actually has 3 questions. Was the evidence presented to support the statement that advocacy is an ethical obligation for you all? What did the evidence show as the most effective form of communication to the House and Senate? And name 2 things that can increase that effectiveness. Let me get this poll going. All righty, you should be seeing that poll on your screen. And we're right at 2 o'clock, so I'm a few minutes over. Sorry, guys. I wanted to leave time for some Q&A at the end. And I'm totally okay with that, but I know some of you are, time constraints are crazy, and you maybe need to get out of this and get back to whatever you were doing. All right, I'm going to end that poll and we'll take a look at it. So I'm glad that I presented the evidence, because that was one of my objectives, was to let you know that it is your ethical duty, and I hope that I've stirred something in you to maybe have you act on that ethical duty. And we'll have, in the next session, we're going to go into a lot more detail on specifics of how you can do that, and the resources to help you do that. What is the most effective communication? Absolutely, it's email. And the research showed that over and over and over. And yes, most all of these could be the right answer. The research strongly supported the personalization, tuning your pitch, and obviously telling a story. Stories are so effective. They have to be real, they have to be authentic, but they are so effective. People remember those. I've gone to the Hill several years in a row, and sometimes we'll meet with the same healthcare staffers, and they will remember the stories we told the last time. So they do remember those. And that is it. We're going to wrap it up. Again, I just want to thank you so much for taking time out of your busy schedule. The next session is scheduled for July 17th, and you should have already received an invitation for that session. I'll be sending out reminders 3 days before, and again on the day before the day of, like I did this one, and I will send you an email with some resources. So I'm going to open it up. I think I can unmute you. I might have to get Kate back over here. I'm illiterate. Participants, I found it. I think.
And there should be an
unmute all. You all are unmuted. Now you may be muted on your side, but you're unmuted on my side. If any of you have suggestions, I would love to hear your suggestions. I would welcome your questions. And if there's something in particular that you would like for me to include on the second session, I certainly will try to hit on that. And I'm sorry, I'm 5 minutes over.
You did good.
Thank you. Thank you. All right. Well, then it doesn't look like there's any questions. Let me see. I don't know if there's a chat box somewhere. Oh, there's the chat box. Maybe.
Oh, I see it.
Is there questions in there, Deanna? Because I can't open it.
It was just a comment from somebody giving you an A+.
Oh, good. Thank you.
That's a good thing.
I was more nervous about the technology than the content. I've spent so many hours in this content, I think I could talk about it in my sleep, but the technology scared me, or not scared me, it worried me a little bit. All right, well then I'm gonna close the presentation, and I will send you guys the recording on Monday. There were several that could not come that actually responded to the survey and wanted to be a part of the project. So I will put the second session together, and I'll see you all on the 17th.
Okay, SuLynn?
Yes, ma'am.
The meeting tomorrow may be by Zoom.
Oh, okay.
Don't know yet, okay?
Okay, I'll watch for some communication on that, and we'll go from there.
Okay.
Okay, perfect. Thank you, guys.
Okay, bye-bye.
Bye-bye.